What exactly causes kidney stones? So kidney stones is a global disease, and the prevalence is increasing day by day because of our bad lifestyle and poor dietary choices. There are certain systemic diseases that can make us more prone to develop kidney stones, like hyperparathyroidism, type 2 diabetes, GI malabsorption like Crohn's disease, GI bypass surgery. So these things can make us more prone to develop kidney stones. Also, obesity can also make us more prone to develop kidney stones. Then there is genetic risk factor also, as well as there is higher male to female ratio. So it is 2:1. So what is the pathophysiology? We'll try to understand. So our urine excretes certain salts, calcium salt, uric acid, oxalic acid. So sometimes what can happen that our urine has too much of these salts, and in that case what it can cause is supersaturation, and subsequently it can lead to kidney stones formation. There can also be case where the volume of urine is less, and that can lead to supersaturation and cause kidney stones. But one thing that is very important here in determining if you will suffer from kidney stones or not is urine citrate. So if it is less, what can happen that there is increased crystallization of calcium salts like calcium oxalate, calcium phosphate, because it's a natural inhibitor of calcium forming salts, citrate. So this is very, very important here, and most of the times this is not often addressed, citrate. So let us understand what exactly causes increase in amount of these urinary calcium or oxalic acid or uric acid. So when you eat too much sucrose or fructose from all those junk foods, it can cause increase in excretion of calcium and make you more prone to develop kidney stones. If your diet is not rich in magnesium, then also there can be increased excretion of calcium leading to kidney stones formation. So oxalic acid is the metabolic end product, and it can be derived either endogenously or from your diet. So some foods are very high in oxalate like potatoes, almonds, spinach. So if you are someone who is a stone former, or if you already had suffered from stone and carry that genetic risk, you are advised to decrease the consumption of oxalate in your diet. Now your gut microbiota has certain bacteria, oxalate degrading bacteria, but it's not very easy to modify your gut microbiota, and it takes a lot of years, lot of time. So the best approach is to limit the consumption of oxalate in your diet. Another way by which you can decrease oxalic acid in your urine is by increasing the consumption of calcium through diet alone and not through supplements, because calcium inhibits intestinal absorption of oxalic acid and decreases the excretion of calcium in urine. But the studies have shown that it should be coming only through diet, because if you take through supplement, it actually causes increase in urinary calcium and increase the chance of developing kidney stones. So try to get all your calcium through diet, and for a stone former it is advised that he gets 1200 mg per day through diet alone and not through supplement, only through diet. Avoid supplement if you have that risk of developing kidney stones. 1200 mg per day. This is very, very important, as well as avoidance of oxalate rich foods in your diet. Then comes uric acid. So limiting the consumption of animal protein is very, very important here, because acidosis, metabolic acidosis, can increase uric acid and it can actually cause kidney stones. And it's very important that you consume enough potassium rich food, vegetables, fruits, because of their net alkali content. Alkalization of urine is very, very important in order to prevent kidney stones. And you can even consider taking a potassium citrate supplement so that you avoid the chances of developing kidney stones. Potassium citrate. Bicarbonate can also, sodium bicarbonate can also help in alkalization of urine and prevent kidney stones, but it is desirable to use potassium instead of sodium, because sodium actually can cause problems later, because it can increase the excretion of calcium. So better use potassium citrate as a supplement rather than sodium bicarbonate. Next important thing is limiting the consumption of sodium to less than 2.5 grams per day, and DASH diet is recommended. Dietary approach to stop hypertension. DASH diet is recommended generally for people who are more at risk of developing kidney stones, or those who already had kidney stones and want to prevent its recurrence. DASH diet, because it's very high in potassium, it's low in sodium, and it's good in fruits and vegetables. So it's very good to prevent kidney stones. Next thing is we should increase the urine volume, because decreased urine volume, especially 1 liter per day, if urine volume is less than 1 liter per day, then the chances of developing kidney stones is almost double. So increase fluid intake. This is very, very important here. You should try to drink plenty of water, as well as you can consider drinking 1 to 2 cups of tea or coffee also. That's also going to increase the fluid intake inside your body and prevent kidney stones. And beer and wine actually have shown to be very beneficial in preventing kidney stones, but I do not advocate you that you should start drinking beer or wine, because they have an adverse effect overall on your body. So, and then there is decreased urine citrate. So how you can increase is by potassium citrate supplement, by enough potassium rich diet, fruits and vegetables because of their net alkali content. So you should be eating potassium rich diet. This is very, very important. Fruits and vegetables because of their net alkali content. Then what you need to do is you need to take a magnesium supplement also. Magnesium is very, very beneficial here. And vitamin A. Vitamin A prevents de-squamation of the epithelial cells, and the first step is the de-squamation, and the first step is de-squamation. So it starts to gets deposited, and it takes years to develop kidney stones. So you want to prevent de-squamation of epithelial cells, and for that vitamin A is very important. So you can consider taking cod liver oil also. This is going to be very, very beneficial for you. If your stone is less than 5 millimeter, 90% of the chance it will come out through medical intervention. You do not have to worry too much about it. Your doctor will likely employ all these natural remedies as well as give you certain drugs so that you are able to pass out that stone easily, like alpha blockers and calcium channel blockers. So these are the medical intervention, and surgical intervention can be used if medical intervention fails.